Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot. It's going to be a short one. We're going to be going over the caring for a patient that is on chemotherapy. Now, before we get started, as always, I'm going to ask you to please support me and support the channel by liking this video, subscribe to the channel if you haven't done so already, and don't forget, I'm now offering next generation NCLEX reviews and one-on-one tutoring sessions. If you're currently in the program and you're struggling, check out the audio lessons I have available on my website, nexusnursinginstitute.com. Now, without any further ado, guys, let's get started. Chemo patients. All right, you're preparing to give a chemotherapeutic agent to a patient. You should recap all needles used to prepare the agents, dispose of the chemo waste in the patient's trash can, use gloves and long sleeve gown when handling the agents, or administer only prepackaged medications from the manufacturer. You can only choose one. What's important to do? Okay, good. Most of you guys chose the correct answer. You're going to use long sleeve, gowns, and you're going to use gloves to handle these agents because remember, these agents are very toxic and you have to protect yourself. Okay? Look at the other choices. The first one, recap all needles used to prepare agents. Let me tell you something. In nursing, do we ever recap needles? Absolutely not. So that's not the answer. Next, dispose of the chemo waste in the patient's trash can. Absolutely not. Again, this is very toxic. It has to be disposed of appropriately. And last, administer only. Let me tell you something. The minute you saw that word only, you knew that wasn't the answer because I told you, do not choose an answer with all inclusives. Only, always, never. Stay away from them unless you know beyond the shadow of a doubt that's the answer. And usually it's not the answer. Okay? Because administering only prepackaged medications from the manufacturer, there are lots of chemotherapeutic drugs that are not prepackaged. So what are you going to do? Only give the patient the medications that are prepackaged? And on top of that, the medications that are prepackaged, you still have to take safety precautions. So the correct answer is make sure you're wearing gloves, because usually we wear gloves when we know we're going to come in contact with body secretions, when we're going to come in contact with urine, with vomitus, with stool, with saliva, with blood. But when it comes to chemotherapeutic agents, you better wear gloves and long sleeve gown. You have to protect yourself. All right, next question. Your chemo patient has developed stomatitis. What should the nurse teach the patient to do? Is it rinse with half-strength hydrogen peroxide and alcohol? Is it to use a soft bristle toothbrush? Is it to drink hot broth and honey to help alleviate the pain? Or is it to avoid the use of dental floss until the stomatitis has resolved? What do you think the answer is? All right, so let's talk about, most of you guys chose the correct answer. Use soft bristle toothbrush. So when it comes to stomatitis, by the way, guys, stomatitis has nothing to do with stomach. I didn't say stomachitis, I said stomatitis. So that's inflammation of the oral mucous membrane. So very often when the patient's getting chemotherapy, they may develop that inflammation of the oral mucous membranes. They're not going to want to eat because it's painful. But guess what? Oral hygiene is still important because that patient messes around and bacteria starts to grow in their mouth. That big bacteria can travel very quickly, and before you know it, patient has an upper respiratory infection. So oral hygiene is still important. So the patient still got to brush your teeth, but they're going to use a soft bristle toothbrush. It alleviates the pain. And another reason the soft bristle toothbrush is important, remember, these patients that are in chemotherapy, the bad cells are being killed, but so are the good cells, right? So we're worried about the RBCs being low, patient being anemic. We're worried about the WBCs being low, patient being at risk for infection. And we're also worried about platelets being low, patient at risk for what? Bleeding. So we're going to want that patient to be using a soft bristle toothbrush anyway. But let's look at the wrong answer choices. The first one, rinsing with half-strength hydrogen peroxide and alcohol, that is way too irritating. The patient already has inflammation of the oral mucous membranes. Do we want to make it worse? by using very strong or irritating agents such as hydrogen peroxide or alcohol? Absolutely not. Next, drinking hot. That was the word that should have made you say, because this patient that has inflammation of the oral mucous membranes, do we want to make it worse? Because their mouth is going to be sensitive already. Do we want them to have anything hot in their mouth? No. If anything, it's going to be lukewarm. I didn't even say warm. I said lukewarm because it's already tender. It already hurts. We're not going to have them put anything hot in their mouth. And last, where it says avoid the use of dental floss until the stomatitis resolves, the patient can't afford to do that because, again, the patient that's getting chemotherapy most likely is going to be at risk for infection because those WBCs may be reduced, right? Immunity's low. We can't afford for them to get sick. Oral hygiene is very important. So they're still going to have to floss. They're only going to floss how? They're going to floss very gently because we want to make sure that we don't cause any abrasions, any cuts, and the patient doesn't start bleeding. How are you guys doing on the live? All right. Your chemo patient is worried about hair loss. What should you, as a nurse, what should you do? Do you teach a patient how to stimulate hair growth by massaging the scalp? Do you explain that the hair loss is only temporary and will grow back after treatment? Do you help the patient to choose a wig before the hair loss begins? Or do you teach the patient to limit social activity until the hair regrows? Wow. So let's talk about this. The correct answer is help the patient choose a wig before hair loss begins, and only 9 of you guys chose that answer. So this is very important. And HESI, ATI, NCLEX, all of them have been known to ask some type of variation of this concept. So let me explain this to you. Patients are going to be concerned about hair loss because it's something real, something that happens. So it is important that you help that patient to choose a wig that is a similar color, similar style, and similar like consistency of hair, what they have right now, so that when the hair loss does occur, that, they can still feel comfortable in their skin. They have a wig that most, resembles what their hair looks like now. Let's look at the wrong answer choices. The first one, teach them how to stimulate. Let me tell you something. If this patient's getting chemotherapy, you can massage that scalp all you want. It's not going to stimulate the hair to grow back. Okay, so that's wrong. Next, most of you guys chose this as your answer, which is explain that the hair loss is only. You're so lucky that you're on the computer right now. You're not in front of me, because I would have wrapped my hands around your neck and started squeezing. Did I not just tell you to not choose the answer that says only? Did not just tell you whenever it says only, always, never, all-inclusive words such as that, it's usually wrong. Why would most of you go ahead and choose this one right here? Explain that the hair loss is only temporary and will grow back after treatment. Well, guess what, Sherlock? Even if it does grow back after treatment, it's going to grow back thinner. It may grow back weaker. It may grow back, what's that word you guys use in English? When the hair is very dry and fragile. I can't think of the name, but it's not going to be the same as before. And they're concerned about the current hair loss. So that answer, the blue that most of you guys chose, it's still not addressing that current issue. And stay away from all inclusives. I told you that already. And last, where it says teach a patient to limit social activity, I'm happy only one person chose that. You're not ever going to tell a patient to limit social activity unless that patient's immunocompromised. And even then, you don't tell them to limit social activity. You just tell them not to go places, public places where there's a lot of people where they can get infection, not to go to concerts, not to go hanging out in the mall, right? Because socialization is still important. And what does that have to do with the hair? No, they're concerned about hair loss. So this is very important. You got to know before the hair loss occurs, you're going to help them choose a wig that's most consistent with what they have now. Nairina says, I was not even thinking. I'm sorry. Okay. Brittle. I forgive you. Rob, thank you. Brittle. That's the word I'm looking for. When the hair grows back, often it will grow back brittle anyhow. Okay. So the best answer choice here is yellow or gold, whatever that color is. I'm sorry I yelled at you guys. You know I love you. All right. What is the most reliable indicator of infection in a client who's neutropenic? Would it be fever? Would it be chills? Would it be tachypnea? Or would it be dyspnea? What do you guys say? You guys are doing great on the live. So I forgive you for earlier. Very good, fever. You see that temperature going up, that is the most reliable indicator that an infectious process is present. Chills, dyspnea, we can see that in, chills and dyspnea, it may be present, but it may not. Those are not going to be indicators of a fever, specific to fever. And tachypnea, same thing, that's not specific to fever, specific to infection. However, when you see fever, when you see that temperature go up, that is specific to an infectious process that's happening, and that's the patient's reaction to fighting that infectious process. You'll see fever. All right, the patient's receiving vincristine. Patient teaching should include treatment of diarrhea, fluid restriction, low fiber diet, or prevention of constipation. I'm sure I butchered that medication, but you guys know I can't pronounce to save my life. But you see the medication, you see what I'm talking about. So anyway, what are you going to teach a patient about this medication? By the way, this is an this is a chemotherapeutic drug. Let me put it that way. This is a chemotherapeutic agent. Very good. Most of you guys got it correct. You're going to teach the patient about constipation. With this medication, patients tend to have like, excuse me, constipation, headache, generalized like malaise, fatigue, muscle ache. Okay. Let's look at the wrong answer choices. Treatment of diarrhea. No, patient have the opposite, constipation. And with constipation, what do you teach a patient about constipation? You teach them to increase fluids, not decrease fluids. You tell them to increase fiber, not decrease fiber. You tell them to ambulate, to move around. We want to increase peristalsis. Select all that applies. Which lab values should you report to the oncologist before you administer your patient's next dose of chemo? Select all that applies. How do we treat select all that apply? As true or false? Here's our choices. A hemoglobin of 14.6, platelet of 42,000, BUN of 12, WBC of 2,300, a temperature of 101.3, urine specific gravity of 1.021. Which lab values should you report to the oncologist before you administer your patient's next dose of chemotherapy? All right. It's select all that apply, guys. More than one answer. Oh, okay. Sorry on the live. Okay. Whenever you get a question asking you, what would cause you to reach out to the healthcare provider? What would cause you to withhold a medication? What would make you deviate from your norm? Really, what they're asking you is what's wrong. Okay. So when we look at this picture, clinically speaking, platelet of 42,000, that's crazy. Guys, your normal platelet is supposed to be about 150 to 450,000. Okay. Platelets are what keeps you from bleeding out. Platelets are what keeps you from hemorrhaging. So a patient with a platelet count of only 42,000, they're at risk for hemorrhage. That's a problem, because you mess around and give them that next dose of chemo and you don't let the healthcare provider know, you can make it even worse, because the chemo, again, it kills the bad cells, but also the good ones. So it could drop the platelet count even lower. Next, WBC. WBC is important for an infection. It fights infection, right? WBCs are supposed to be 5 to 10,000. This patient only has 2,300. That's a problem. This patient's at severe risk for infection. If you don't let that healthcare provider know and you just give that next dose of chemo can drop the WBC level even lower. And last is, of course, the temperature of 101.3. That's letting us know this patient most likely has an infectious process happening. Okay, so we have to let the healthcare provider know all of the other values are within normal range, so there wouldn't be anything to report. You're always going to report what's wrong. If your patient's good, we're happy about that. Your cancer patient has lost 30 pounds in 6 weeks. Which lab results should you report to the oncologist? Would it be a blood glucose of 97? Would it be a total cholesterol of 180? Would it be a hemoglobin of 14 or albumin level of 2.9? Someone asked, does platelets and WBCs correlate? Like if one goes up, the other goes down? No. All right. The correct answer to this, guys, is albumin level. I'm so proud of you guys. Most of you chose that. The normal albumin level is 3.5 to 5. This patient's only at 2.9. 2.9. Remember, albumin, guys, is a type of what? Protein. So the fact that we see that albumin level so low, that lets us know most likely this patient's experiencing catabolism. What's happening is we have those molecules, we have those muscles, we have those cells, we have those tissues, what? Breaking down. This patient's at risk for what? Malnutrition. That's why they've lost so much weight. That's our problem. That albumin level, all those other levels are within normal ranges. Which diagnostic value should be assessed in the patient receiving chemotherapy? Is it bone marrow cells, liver function studies, cardiac enzymes, or pancreatic enzymes? Which diagnostic value should be assessed in the patient receiving chemotherapy? Okay, let's talk about this because I'm so happy most of you guys got it correct, bone marrow cells, but on the live, most of you guys were typing in blue or saying liver function studies. So let me explain why it's bone marrow cells. Remember how previously I was telling you when the patient's getting chemotherapy, we're concerned about decreased WBC, right? Which means the patient will be at risk for infection. I told you we're concerned about decreased RBCs, patients at risk for anemia, and we're concerned about decreased platelets. Patient would be at risk for what? Bleeding, hemorrhaging. Well, guess where those cells are made? Guess where the RBCs are made? The WBCs and the platelet? In the bone marrow. The bone marrow. So the bone marrow is affected by chemo, and that's why those platelets and the WBCs and the RBCs are decreased. So when we're assessing our patient that's getting chemotherapy, an important diagnostic value is to look at the bone marrow cells, the red blood cells, white blood cells, platelets. All right, guys, last question. Your patient's receiving chemotherapy has an elevated creatinine level. What should you do next? Should you cancel the next chemo session? Should you give the next scheduled chemo dose? Should you notify the healthcare provider, or should you obtain a urine culture? Your patient that's receiving chemotherapy has an elevated creatinine level. What should you do next? Very good. You're going to notify the healthcare provider. So let's talk about this. Creatinine is the most specific indicator for kidney function, right? So when we see that creatinine elevated, that lets us know that the kidney's being affected. Remember, this patient's on chemotherapy. Guess what? Chemo's nephrotoxic. So most likely what's happening, this patient may be going through kidney failure. So we're going to notify the healthcare provider. And just a hint, whenever you're looking at a test question, and they tell you something's going on and they ask you what you're going to do, usually the answer that you are not going to choose is to go ahead and give the med anyway, or to go ahead and document, or to go ahead and monitor. Because if it's a test question, usually, not all the time, but usually that means something's wrong, which means there's a nursing intervention that you got to do. Not all the time. Sometimes everything's perfect and all you got to do is just continue what you were doing. But usually there's something wrong. That's why it's a test question, because they want to see if you know what you're supposed to be doing. Now let's look at the wrong answer choices. The first one, cancel the next chemo session. Well, guess who's going to cancel that chemo session? The oncologist, the healthcare provider, not you. You're going to reach out to the healthcare provider. If anything, you're going to withhold a medication. You're going to withhold the medication, then reach out to the healthcare provider, but you're not going to cancel it. That's not within your scope of practice. Next, give the next scheduled chemo dose. You're letting the test writer know that you don't realize something's wrong. You just turned into the op because you're trying to kill your patient. You just turned into attempted murderer, okay? And in nursing, we don't kill, we heal, right? So we're not going to do that. And then last, obtain a urine culture. What is that urine culture going to tell us that we don't already know by that creatinine? That creatinine, that elevated creatinine, lets us know the kidneys are in trouble. So why are we taking the urine? What? Okay, what if there's bacteria in the urine? Okay, patient has a UTI. So what in the face of kidney failure, right? Do we really care about seeing bacteria or maybe even RBCs in the urine? Absolutely not. We got bigger problems on our hands. If the creatinine is high, we're worrying about that patient going in kidney failure, because again, chemotherapeutic agents are nephrotoxic. They are very hard on the kidneys. And guys, that is it. This was a very quick Kahoot, but I wanted to go over the most important concepts you need to know regarding chemotherapeutic agents and caring for patients who are on chemo. So let's see how you did.